Last week we spoke about acute pain, but chronic pain isn't an entirely different beast at all. Unlike acute pain, chronic pain is not a helpful protective mechanism, and it's actually a disease process in itself. In fact, the World Health Assembly in May of 2019 actually classified chronic pain as a disease, and that will be coming to common use in 2021. It's currently being trialled in a number of centres around the world. So chronic pain, what causes it? It's not really just all in your head, which is what a lot of people interpret chronic pain as. It's a very complex process, actually. It does involve some psychological inputs, but it is most definitely biologized within your body, and that manifests in a number of different ways. Primarily, it manifests as a hypersensitivity of your nervous system. So it's like your body has a hypersensitive alarm system. So it's like if you imagine a car alarm and you just walk past it. You're not actually trying to break into it, but you're just walking past it. And just the wind from your body walking past the car is enough to trigger that alarm. That's what chronic pain is like. Remember going back to those nociceptors or those danger sensors that we have in our bodies that pick up stimulus such as mechanical stimulus, chemical stimulus, and temperature stimulus. In the case of chronic pain, the threshold for those stimulus is lowered, so you'll start to feel pain just with a simple stretch, or when you get cold, or if you've been sitting still for too long, even that pain will you'll actually start to feel pain. So that's where there is no danger present, but your brain, your body, your nervous system is telling you that there is, and that's why you're feeling pain. So it's not helpful. Usually people who have been experiencing chronic pain, which is generally thought of as pain that's lasting longer than 3 months, do feel the need to limit their activities, and they can become very fearful of moving. Sometimes they can be quite depressed. Having an understanding that the pain that they're feeling is not signalling the amount of tissue damage is important, because then we can make sure that we're managing those activity levels appropriately and we're not descending into emotional distress, deconditioning, further weakening, further comorbid disease like putting yourself at more risk of heart attack or diabetes and things like that. So it's really important to have a really good understanding of what chronic pain is and how to interpret the signals that you're getting from your body, and know when to listen to them, when we can push through a little bit of pain and how much pain to push through. All of this can be quite a complex minefield to delve into and to negotiate. So it's really important that you are guided through that process with some appropriate help, and that's what we're here for. Okay, so hopefully this gives you a little bit more of an understanding of what chronic pain is and how we can help you here at Logan Physio. Thanks, guys.